9. Traditional institutions and social welfare. 1. Understanding social welfare in traditional contexts. Social welfare under traditional governance includes provision of basic needs, food, shelter, and clothing during emergencies or festivals, assistance to widows, orphans, and impoverished community members, health and well-being, support for preventive healthcare, maternal care, and access to herbal or traditional remedies, coordination with modern healthcare programs for vaccination drives and disease prevention, education and knowledge transmission, promotion of literacy, apprenticeship, and vocational training, preservation and transmission of indigenous knowledge, culture, and values, conflict resolution and social harmony, ensuring disputes do not undermine welfare programs or communal resources, mediating access to resources fairly among community members. 2. Mechanisms of social welfare delivery. Traditional institutions utilize structured, participatory, and culturally rooted mechanisms to provide social welfare. Community assemblies, community gatherings to identify vulnerable individuals and allocate resources, facilitate collective decisions on welfare distribution. Councils and elders committees oversee implementation of welfare programs and ensure fairness. Monitor compliance with customary rules of aid and support, customary norms and moral obligations. Leaders enforce social responsibility through moral persuasion and communal expectations. Rituals and symbolic acts encourage voluntary contributions from affluent members. Collaborations with external agencies partner with NGOs, government programs, and donor organizations to supplement local resources. Ensure integration of traditional practices with modern social welfare initiatives. Third, specific welfare roles of traditional institutions. Care for vulnerable groups, orphans, widows, the elderly, and people with disabilities receive targeted support. Community-based safety nets, social insurance mechanisms, rotating funds, cooperative societies, and communal labor initiatives. Cultural and spiritual welfare. Rituals, festivals, and ceremonies strengthen community solidarity and mental well-being. Conflict prevention for welfare protection. Ensuring equitable access to resources prevents disputes that could undermine social welfare programs. Fourth, challenges in traditional welfare systems. Resource scarcity. Limited financial or material resources constrain the effectiveness of welfare programs. Urbanization and migration. Breakdown of extended family systems reduces community support networks. Political interference. Government policies or external agencies may conflict with customary welfare priorities. Inequitable distribution, favoritism or bias may marginalize certain groups. Modernization pressures, changing cultural values may reduce compliance with traditional welfare norms. 5. Contemporary relevance. Traditional institutions remain vital in promoting social equity, community cohesion, and resilience, especially in rural areas. They complement government social programs and serve as culturally sensitive conduits for development. Integration with modern social welfare systems ensures that interventions are inclusive, participatory, and sustainable.